Therapists have read it. What differences have you noticed between men and women among your patients? I'm a clinical psychologist working with adults and older teens, specializing in trauma, anxiety, depression, eating disorders, and sleep issues. From what I see, gender differences in therapy are consistent and reflect social conditioning. Men usually find it much harder to be emotionally open in session. They cling to rational analysis and problem solving. When a strong feeling shows up, they often freeze with the core belief, I don't want to feel this. So a lot of the work isn't about the emotion itself, but about their relationship to it. Women can also be emotionally closed off, but usually because of trauma. For example, if your dad hit you every time you showed emotion, it makes sense you learn to shut down completely. With men though, emotional detachment often shows up right from the start, even without obvious trauma, which says a lot about how boys are taught to handle feelings. I'm reminded of Bell Hooks' idea. The first act of violence that patriarchy demands of males is against their own sensitivity. I'm not a therapist, but I spend a lot of time in relationship therapy communities. One pattern I see, men often hear their partner's words as criticism because they feel personally responsible for the success of the relationship. They see her as a teammate. So when she says, here's a problem, she usually means, let's tackle this together. But he hears, fix this solo or you're a failure. That defensiveness makes him pull away, which makes her feel unheard. That in turn creates tension that eats away at the relationship, reinforcing his sense of inadequacy.